Hi, I'm Susan Taylor with Scripps Health in San Diego, California. Cardiomyopathy is a disease of the heart muscle that makes it harder for the heart to pump blood through the rest of the body. How do you diagnose and treat it? Joining us to talk about this is Dr. Rajeev Mohan. He is a cardiologist and a heart failure specialist with the Scripps Clinic Medical Group. Doctor, thanks so much for being with us.
Thank you for having me.
So, go into a little bit more detail. What is cardiomyopathy?
So, like you said, cardiomyopathy is a problem where there's some sort of damage to the heart muscle where it's just not squeezing properly, not getting enough blood out. You can see this is sort of a picture of a normal heart where the heart muscle is in the normal kind of dimensions. So there are a variety of different kind of cardiomyopathies that can actually affect how the heart is able to squeeze. One type of cardiomyopathy, for example, is when the heart muscle gets too thick. So this part of the heart, which is called the left ventricle, can become too thick, and as a result of that, it doesn't effectively pump blood out. Another one is called dilated cardiomyopathy, where the heart actually balloons out and becomes much bigger. And as a result of that, it just doesn't squeeze as efficiently as it should. There are a number of other cardiomyopathies as well. Another one that we see more and more of is something called amyloid cardiomyopathy. And that's a problem with proteins that are depositing within the heart muscle, also causing it to get thicker as well. There are other ones like what's called arrhythmogenic cardiomyopathy. This is due to actually an abnormal rhythm that causes heart muscle dysfunction and ultimately can lead to all the same type of problems of congestive heart failure.
And then there's also this stress-induced one, which is also known as broken heart syndrome.
That's correct. Like you said, there's something called stress-induced cardiomyopathy. This is something that can be triggered by a very significant stressor, whether it's an emotional stressor or a physical stressor, but basically causes the heart to go into almost like a stunned phase where it just doesn't squeeze properly.
And how long does that last?
More often than not, that is a relatively short episode where once the stressor is resolved, once we've treated the heart failure, we can get some recovery in the heart muscle function. That would be the ideal outcome.
So, what are the symptoms of cardiomyopathy?
So typically what we're looking out for are symptoms of what we call congestive heart failure. Now, the symptoms of congestive heart failure sometimes can be a little bit tricky because they can mimic some of the other symptoms that people can have for a variety of other diseases. But one of the main things that we see in congestive heart failure is shortness of breath, particularly when people are exerting themselves, just going for a walk or climbing up a flight of stairs. Another common symptom that we see with congestive heart failure is swelling. So because of how the heart is trying to keep up with the demands of the body, it starts to retain more fluid in the system. And when there's extra fluid in the system, that starts to leak out and cause swelling, particularly in the ankles and the feet.
So, how common is cardiomyopathy?
Cardiomyopathy is one of the most common things that we see in cardiac patients. There are, again, a lot of different things that can cause cardiomyopathy, including things like high blood pressure that's been around for a long period of time, heart artery disease leading to heart artery blockages. All of these different kinds of things can contribute to cardiomyopathy.
And who is most at risk?
The highest risk people for cardiomyopathy are people that have some of those underlying risk factors, like high blood pressure, coronary artery disease, diabetes. Those are the kind of more common things that we see as a result, or that can cause cardiomyopathy.
And is there a genetic component? Is this something that parents can pass on to their kids?
That's a great question. There are a whole sort of group of cardiomyopathies that can be genetic in nature. So these are the kinds of things that can be passed from one generation to the next. So when we're doing an evaluation for somebody who has a cardiomyopathy, that is one of the things that we offer is a gene test to determine whether or not there is a genetic component.
So, how do you diagnose cardiomyopathy?
The most common tool that we use for the diagnosis of cardiomyopathy is what's called an echocardiogram. That's basically an ultrasound test that we can do sometimes just at the bedside or sometimes in the echo lab itself. But we're basically getting a view of the heart, all the muscles involved in the heart, even all the valves that you can see here inside of the heart. So we can get a really good look at the heart by utilizing an echocardiogram.
How do you treat it? I mean, is there medication? Is there surgery, implanted devices, lifestyle changes?
Great question. Honestly, it's all of the above. It really kind of depends on what type of cardiomyopathy is causing the problem. There are some cardiomyopathies where we have very specific treatments to treat that particular problem. An example of that is hypertrophic cardiomyopathy, where there's an extra heart muscle that's built up, and we have medicine that can target that specifically. Another specific example is amyloid cardiomyopathy. We have certain medicines that are used specifically to treat that. But for the other types that are more common, dilated cardiomyopathy and such, there are a whole host of medicines that we use, which we call guideline-directed medical therapy, but it's just a sort of fancy term for a number of different medicines that we use to help strengthen the heart muscle and prolong life.
And what about surgery or implanted devices?
Many people with cardiomyopathy may be candidates for different types of implantable devices as well as surgeries. The most common implantable device that we use is something called a defibrillator or an ICD. The purpose of this device is to essentially listen to the heart's rhythm and detect if there's any dangerous abnormal rhythms that are happening. People with certain types of cardiomyopathies are at higher risk for these type of dangerous rhythms. And so the purpose of a defibrillator is to listen for these rhythms and shock the heart back to normal if an abnormal rhythm were to occur. That device is implanted in the chest wall, and it has wires that go in through a vein and lead directly into the heart and do the listening and shocking if they're needed. More advanced patients when their cardiomyopathy has progressed may be candidates for a surgical procedure called a left ventricular assist device. This is actually open heart surgery where a cardiothoracic surgeon implants a heart pump, which effectively takes over and does the work of the left side of the heart. We call this a left ventricular assist device, and patients can live many, many years after an implant of this device.
And what's the downtime for that?
For a left ventricular assist device, because it's an open heart surgery, it's a bit longer. People are typically in the hospital for about 2 weeks or more, just depending on how quickly the recovery is going after the surgery. But the overall downtime can be a bit longer, more on the order of about 2 months until people are really feeling back to normal.
And what about lifestyle changes?
Lifestyle changes are very important as well. The most important thing that we tell our patients every day is just to try to stay as active as they can. Walking every day, as easy as it may seem, can sometimes be a challenge for patients with cardiomyopathy. So the more that patients do, the longer they'll be able to maintain what they can do. So we definitely encourage a lot of physical activity, or as much physical activity as people can manage.
And what causes cardiomyopathy?
So it really goes back to some of the underlying risk factors that many people can have, which includes high blood pressure, high cholesterol, heart artery disease, and blockage. So really the most important thing that we can do to try to prevent cardiomyopathy is making sure that all of those other things are treated as best as we can.
So if left untreated, what can happen if you have cardiomyopathy?
If left untreated, cardiomyopathy can be a fatal disease. And so that's why it's really important to get this checked out for people that have those type of symptoms. We want to make sure that we're looking at the heart more closely so we can better understand if somebody has a cardiomyopathy.
So when should you go see a doctor?
The most important symptoms to look out for are things like shortness of breath, chest pain, swelling in the legs, palpitations where you're feeling like your heart is skipping a beat or racing just sort of randomly out of the blue. Those are the kinds of things that we do get worried about that may be related to heart muscle dysfunction.
Any final thoughts, doctor?
Cardiomyopathy can really affect men and women equally. And depending on the type of cardiomyopathy, it can start to cause symptoms as early as in your 40s, 50s, and 60s. So it's really important for all of us to make sure that we're listening to our bodies. And if we start experiencing any symptoms that may be heart related, that we get it checked out sooner rather than later.
Thanks so much for joining us, doctor. We appreciate you taking the time.
Thank you for having me.
If you want more information on cardiomyopathy, just click on the link or go to scripps.org/videos. Want more critical information about your health? Please subscribe to our Scripps Health YouTube channel and follow us on social media at Scripps Health. At Scripps, we're here for good. I'm Susan Taylor. Thanks for joining us.